It's the most wonderful time of year. It came to an abrupt halt, but it is the most wonderful time of the year, unless, of course, you have come down with the flu. And we were telling you about the fact that the vaccine this year has just not matched up the way that it should. And we've set up the scenario for you, and it's kind of unprecedented to hear the Center for Disease Control say that the flu shot is no good. But that is just what they have said. Now, joining us as promised is Dr. Al Johnson. He is a doctor of internal medicine. He is a medical expert, to say the least. And, Doctor, it is good to have you on the Tom Maher Show this morning. I believe that you have been with us before.
Yes, I have, and I thank you again.
All right. Now, have you had your flu shot?
I have.
All right. I've had mine as well. I tried to convince one of my sons, you've got to get a flu shot this year, but he decided not to do it. He just, for whatever reason. Now, how could they get it so wrong this year, Dr. Johnson? How did that happen?
Well, I don't know that they got it wrong. They just didn't get the right strain in the vaccine, which is going around. It's a predictive issue, a best guess situation. It's the same vaccine that they had last year, the same mix of three viruses, the swine flu virus, which is H1N1, then they have a Texas type A and the type B Massachusetts. And it was effective last year, and it's effective this year in that your bodies produce antibodies to those viruses once you get the shot.
If they show up, if that's what shows up with your,
right.
And you have the flu, okay.
And so it works. It's just not specific towards the one that's going around right now because it was not able to be predicted which one it was.
Now, I never, and I've been around for a long, long time, I've heard the CDC come out with an announcement that the vaccine doesn't work. But you say if for some reason the type that was around, should it come around later on, that the flu shots will work. What do you say, Dr. Johnson, to your patients on whether or not they should still get the flu shot even after CDC said it does not work?
Yeah, I think the term does not work is
well, it was theirs, not mine.
Yeah, it's a little misnomer. It's effective for what it is, but it's not working because this year towards the one type A virus that's going around. My message is if you've not had adverse reactions to the flu vaccine and you aren't allergic to it in some manner, then it makes sense to get it because it is protecting against those common flu viruses that are potentially out there. And it does help stimulate your immune system, so it could mitigate a little bit if you do get the flu of a different related strain.
All right, doctor, while we have you here, and people decide not to do that, again, and go over for us the best ways to keep from getting sick with the flu. And I think I know what they are from when my mama, an RN for 50 years, she just banged into us as little children, wash those hands, hot soapy water 4 or 5 times a day. But what else other than that?
Yeah, well, washing your hands is important. Not if you're out, not touching your face with your hands after you touch different things. Be careful in big crowds. People are sneezing and coughing. You want to stay away from that. If you're sick, don't go out, and then if you do have to go out, wear a mask. If you are sick, also wash your bedclothes and your sheets and so forth to keep from spreading the virus. Carry Kleenex with you. If you're sneezing or coughing, sneeze into the Kleenex so you can not expose others. And then wash your hands, of course.
Now, what about the hand sanitizers? I went out and got 4 or 5 bottles the other day, small bottles that you can carry with you, like 2 fluid ounces. Yeah, no, they work. They do work, and that's one way to take care of it, to help keep your hands clean, and so you are not spreading it or you aren't picking it up from what you're touching. Now, what is usually, Doctor, the life of the flu season? I said strictly off the top of my head it will probably end around March, maybe April, but is there a way that you doctors realize that, well, come this month or that month, we're through the worst of it and the season's over, or is it something that's never over?
Well, it's around a lot, but it's during the cold months, just as you said, when people are cooped up in tight places, and so you're correct. That's the major time of it.
Okay, well, we want to thank you for being on with us today and for giving our listeners the hints on the best way to shorten the life of the flu season by taking the activity. And by the way, if I'm leaving, I try not to grab the handle of a door. I try to use my elbow with my shirt on to open the door that way rather than grabbing the handle, because a lot of people touch handles. They may have the flu. I mean, that's another minor way that can help too, right? Being careful the way you go in and out of a door.
Oh, yes, it is. And I think the message needs to be this year is that if you do get the flu, you can get medicine from your doctor, prescription for Tamiflu or Relenza that will help calm down the symptoms and mitigate the process. Also, if you continue to be sick, you may get a secondary bacterial infection, which you need an antibiotic for, and that's typically in those that are older, those that are immunosuppressed or taking immunosuppressive drugs, or have a history of just having increased infections.
All right, Dr. Johnson, thanks for being with us today. We certainly do appreciate it. And
you're entirely welcome.
We hope to talk to you again.